Is there one best way to remove the fat?
There are many different ways to remove fat for liposuction. The time-honored way is to use a tumescent solution, which we inject into the area where we're going to liposuction. The tumescent solution is usually a combination of saline or lactated ringers, which is like a saltwater solution, some lidocaine, which is a numbing solution, and epinephrine, which is a solution or a drug that you use to kind of cause the blood vessels to vasoconstrict, so it decreases the amount of potential bleeding. Another component that we've been adding to our liposuction mixture is something called tranexamic acid. And the nice thing about tranexamic acid, it helps stabilize the platelets and causing decreased bleeding, so there's less black and blue after surgery. In terms of the different techniques, well, I've been in practice for 30 years. I've done regular liposuction, which we didn't use tumescent solutions. And then there's something called ultrasonic liposuction. And then there's something called power assisted liposuction, laser assisted liposuction. Those are probably the three most or four most time honored ways to remove fat. Presently in my practice, I use a combination of ultrasonic liposuction and power assisted liposuction. Ultrasonic liposuction can usually is done with a product called a Vaser, VASER, or an older Mentor Contour Genesis liposuction machine. Those are the two machines or techniques of mechanization that we use for liposuction. I've gone away from ultrasonic liposuction and used more something called a power assisted liposuction, which I'm sure lots of people have seen videos where people go back and forth like this with a liposuction cannula to remove the fat. In my hands, the combination of the old-fashioned liposuction where I do it like this with different size cannulas and using power assisted liposuction are the mainstay of my practice. I've been getting beautiful results with this technique, and also I'm finding that there's less black and blue the way I've been doing it these days than it has been over the past several years. So that's what I use. The laser assisted liposuction or smart liposuction, which here advertised a lot, is used as a laser beam to kind of remove the fat. The problem I have with the laser beam is a laser beam, like any other light, it shoots out at anything in its path it's going to burn or destroy. Well, that's not necessarily a good thing because you everywhere along the path of where that light wand's going to go, you burn tissue. As far as I'm concerned, I think using a blunt cannula with holes on it, which is the traditional or power assisted liposuction technique, offers a much less traumatic way to do the procedure to be able to get the greatest amount of fat away. And that's the way I perform it. Now, that's in my hands. Typically, we'll put patients to sleep versus do that awake. Neck liposuction we will do with patients awake merely because it's a smaller area. I can get good control with pain medication in the liposuction volume that we put in with the tumescent fluid because we don't get into any problems with heart issues. If you use too much lidocaine, one of the side effects of lidocaine and norepinephrine, it can cause issues with the heart. So we like to stay away from things that could cause issues to the heart. Now, there are other things that involve a liposuction. That's why we encourage people to come in for evaluation because some people are good candidates for liposuction and candidates are not good for liposuction. For example, there's something called BMI, body mass index. If you have a very, very high BMI, or for example, if you're obese, liposuction is not going to be a good procedure for you because you're not going to get enough contouring of the tissue to make it worthwhile. In a typical liposuction session, you're probably going to remove anywhere between 8 and 10 pounds of fat. And if you are 70 to 80 pounds overweight, it's probably not a good procedure for you because I don't think the risk-reward ratio is going to be acceptable for the patient because they're going to spend a good amount of money for their surgery and they're going to look at themselves and they'll see a change because you do take out the amount of fat we're talking about, but maybe not enough. So if you're closer to your BMI and you have a little bit of extra poundage where you've done a lot of work and exercise, which somehow working out, what do I mean by work? I mean working out and eat properly, and there's certain areas which are not good that have improved with diet and exercise, like the abdomen and the flanks and the chest on men, then maybe liposuction is a good thing for you. And what we usually will tell patients, or I tend to tell patients, if you can pinch about an inch of fat in an area like here or the abdomen, then you're a good candidate for liposuction, because the amount of fat you're going to take away will be appropriate enough that you will see a very much improved body contour change. So again, if you weigh 50 pounds to 80 pounds or more over your ideal weight, you're probably not an ideal candidate for liposuction.
Is
So
liposuction a weight loss procedure?
liposuction can be considered a weight loss procedure, but I shy people away from that because, as I said earlier, unless you're doing a lot of lipo, and in Florida, the max you're supposed to be able to legally and safely take off somebody in one session is about 5,000 grams. And of that 5,000 grams, perhaps you lose about 8 to 10 pounds at the max. So if you're 10 pounds overweight, you're probably a good patient to have the liposuction, but I wouldn't say it is really a weight reduction procedure, but more of a recontouring to get you to feel a little better about your, like for a woman, the curves of her body, her abdomen be a little flatter and straighter. The man have the abdomen a little bit smaller and the hip areas and the flanks looking better. Or in a woman, like I said, they tend to put it also besides the abdomen and flanks, they put on the lateral thighs, and sometimes those areas a little bit larger than the women would like, and it's nice to be able to take those areas down. So liposuction, you know, people will call it liposculpturing because it's a nice word versus liposuction, and I kind of will say that's a reasonable thing to say because the liposuction is sucking away fat. Are you sculpting the tissue? Yes. So I think those are two reasonable explanations for what we try to do with the liposuction. We use different size cannulas with different holes in them to take out the fat as safely as we can. And I don't really think, in all, that liposuction should be thought of as a weight reducing procedure, but sometimes it will help a person get a jump start, meaning that you can certainly improve certain areas that you're liposuctioning very quickly because you're taking the fat down. And then when you're wearing the post-operative garment and you put your clothes on, you like what you're seeing, your clothes are feeling better. So when you go out for dinner, maybe you won't have an extra piece of bread in the bread basket. Or when it becomes time for dessert, maybe you won't have a dessert. Or instead of having 2 glasses of wine at dinner, maybe you have 1 glass of wine. So I do know that diet modification with appropriate workout regimes with liposuction is a very good formula to success to improve body shape and body image.